Why is the new Sleep Number 360 smart bed your answer to better health and wellness? It's proven quality sleep. Any more questions?
Yes, I'm always freezing, and he overheats.
It's temperature balancing, so you can sleep better together.
But can it help keep us asleep?
It senses your movements and automatically adjusts to keep you effortlessly comfortable.
So I'll have more energy for yoga.
Yes, proven quality sleep is life-changing sleep.
Namaste.
Namaste to you, too. And now, save up to $1,000 on the new Sleep Number 360 smart bed and adjustable base, only for a limited time. To learn more, go to sleepnumber.com.
Welcome to the Beverly Hills Plastic Surgery Podcast. Dr. Millicent Ravello and I are here today, and I'm Dr. Jay Calvert, by the way, in case anybody didn't know. We are here today to talk to you about scars.
This is a big topic, scars. Good evening, by the way.
Good evening to you.
Good evening.
I'm looking forward to our Scar Talk. That could be its own talk show.
Scar talk.
Welcome to Scar Talk. I mean, could you imagine? Because there's a story with every scar.
There is, right? And people love to talk about their scars.
Totally.
Yeah, I got this back in la 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 la. Yeah.
Yeah,
for sure.
There's a story around every scar. I think you really learn when you see stuff that isn't like a surgical scar. Okay, fine, you had your gallbladder out or whatever. But like when you see like an arm scar that looks like their arm might have been like put through a shredder.
It might have been.
And then
that might be your story.
Oh, okay, what happened to this?
What happened to your arm?
I rolled my car. My arm was outside. You hear these things. You're like, whoa.
But people don't really ask about scars. I think it's sort of one of those taboo things where it's like, I don't know if the person wants to talk about it.
They can be sensitive.
They can be sensitive. Maybe I shouldn't bring that up.
Especially facial scars.
Yeah.
Bad facial scars nobody likes.
Nobody wants to talk about that.
But let's talk about surgical scars and scar management strategies so that after your plastic surgery fun, you can get the best wound healing possible.
Yes, and this is a huge thing for us. This is the question I get even before I've done surgery. So, doctor, what are we going to do about the scars? I'm like, let's get through the surgery first. You've jumped the gun like way ahead here. But I get it. It's big on people's minds because that's one of the things that is frequently prohibitive to patients when they're thinking about doing plastic surgery.
Easy for you to say.
Easy for me to say. Particularly of the breast and body because those are big scars. Breast reductions, breast implant surgery sometimes, tummy tucks. These are big scars. And so a lot of times patients are averse to having surgery because they don't want the scars.
Breast reduction.
Breast reductions. So how can we make these scars optimal?
Well, people always... you have to kind of understand why we suture wounds closed. I mean, yes, we want them closed, but we use different types of suture to support the healing of the wound. We keep the edges of the incision in close proximity using sutures that are either permanent, not that we're not going to take them out, but they would not come out unless you take them out. So they're made out of nylon or Prolene or something. They're plastic. And they only will come out if we remove them. And a lot of times we use absorbable sutures, such as monocryl or Vicryl or these other polymer plastics that are very soft and pliable to close the wound because they will then absorb on their own and we don't have to remove those
them.
sutures.
And they're on the inside of the wound. And this is always the joke of plastic surgeons. Anytime you go to a hospital or anywhere, the nurses and everyone roll their eyes when the plastic surgeons come in because we are obsessed with our sutures and we're very particular about the kind of sutures we want. We want the size to be correct. We want the material to be perfect. We want the needles to be the right size, shape, and curvature. And so every other surgeon out there is like, give me whatever you got. And we're like, no. We need the 5-PDS on a P3 needle. And they're like scurrying around trying to get our sutures. There's a whole cart dedicated just to plastic surgery sutures because that's how particular we are about our sutures because they mean something. We don't put them in willy-nilly. They serve a purpose in making your scar as perfect as possible. Because not only is it about getting that scar and that wound closed, it's about the kind of tension that it's put under when we close and how long those sutures take to absorb and the tensile strength of them. So it's not nothing when you go to a plastic surgeon to have your scar revised because we have put a lot of thought into making these scars as good as possible.
I want to go back to something you said.
Yes.
You said that the nurses roll their eyes over our sutures. That's one of many reasons they roll their eyes at the plastic surgeons. And there's a lot of eye rolling
reasons.
when the plastic surgeons come into the operating suite.
There's not a lot of nurses